Steve here on install day for Spine and Joint Centre, and just sort of show you what it looks like when we come and bring a machine. So the machine comes in a great big van, and we have a wooden crate where all the parts come bubble wrapped, securely packed. We've taken some bits out. We're going to offload, take it into the clinic, get things set up. Once we're in the room, all quiet, we crack on, and the next thing will be, voila, a machine. So we're going to bring the tower off now. We're just going to breeze that down. It's on its skateboard dolly, and we'll bring that in now. Just going to lift this. Fantastic. So the tower is just going to be twisted round. Step one complete. This is a very easy one because it's just straight in. But we can lift them on the side, put one on the shoulder, no problem. So this is the last piece, the table, and it's always nice when it's not raining. So as we're assembling the pieces onto the machine, there are the main components. It all slots together neatly, screw it in, tighten it up, and then we're going to be getting ready to test the machine. Securing the table to the base, these two pillars which are going to rise up and down. Little squeak, that's in position. All good. So all finished, all set up, and running a test session now. I've connected the, so we call this the decompression motor. This is connected to a belt, just connect that round. We call this the foot plate. The treatment is controlled by computer. So we have tension in pounds on the, what we call the y-axis, and then the amount of time. So we have a target session, and then the red line is just the actual tension that's being pulled. So we know exactly what's being delivered to the patient. So we're just going to test the cervical now. The cervical fitment will be connected here, and this part here will raise up, and it's that which gives us the angle to focus, commonly C5, C6. For patients, especially those who've got like difficult disc problems and leg pain, getting onto a horizontal table can be difficult. So we have a table control, and this can take people who weigh up to sort of 190 kilos, sort of about 30 stone even. And then the other aspect of the table tilt is really when a patient is finished the treatment and they're getting off. So that safe return to load bearing from being horizontal, having had sort of 26 minutes on the machine, it just means that we can bring them up gradually, soft tissues can reset, and then they're more comfortable. So table goes up, and then it's going to come down. So this is a really important sort of safety feature when treating these sorts of, difficult conditions. So this is the finished item assembled. We've got cushions and harnesses that we're going to go into some storage units. But as you can see, we've put this machine against the wall here. We've got plenty of space. This particular room has a treatment couch that can come in here, but equally it's got room for a second machine further down the line. So nice and straightforward, ready to go, expanding the spine service in the clinic. So good. If you want to reach out, we want to see whether this is going to fit in your practice, and then get in touch. You can always take a little video of your space, and we can have a look at it and see, where we can get your machine in. But it's quite straightforward. So yeah, thank you.